Breakthrough infection. What's your chance if you're fully vaccinated against COVID 19? Being fully vaccinated against COVID 19 can feel like a milestone for many people, as if a great burden got lifted. However, experts still do not recommend them to ignore health protocols just because they are more protected than others. The reason is the small possibility of a breakthrough infection where a fully vaccinated person contracted the disease. According to NPR, the rate of breakthrough cases is incredibly small when compared to the number of fully vaccinated individuals. Only 5,800 of 66 million fully vaccinated Americans caught the disease, and they are most likely to survive because of the protection. So taking preventive measures remains key in protecting yourself and others from the coronavirus. For a longer explanation, existing COVID-19 vaccines do not offer absolute protection. The Pfizer-BioNTech and Moderna vaccines are gauged with around 95% efficacy, while the Johnson & Johnson vaccine scored 66% globally and 72% in the US. Obviously, there is a hole in the efficacy rates of these vaccines. Thus, a fully vaccinated person has a slim chance to get COVID-19, though less than 1% is the estimated chance. Charlotte Baker, assistant professor of epidemiology at Virginia Tech, said, "Everybody sees that the stats are not 100%, but that immediately goes out the window and people just think, I've been vaccinated." Dr. Anthony Fauci, director of the U.S. National Institute of Allergy and Infectious Diseases, confirms that no vaccine offers 100% protection in the real world. These include non-COVID vaccines like diphtheria and tetanus. If someone completes the whole vaccine series for diphtheria, they can get 97% protection. If someone completes the series for tetanus, they are virtually 100% protected against the disease, as per the US CDC. As noted, virtually likely means consideration of various factors, such as pre-existing health conditions, the status of the immune system, and lifestyle, which may affect the protection level. If there is no perfect vaccine, why is COVID-19 vaccination being accelerated? The answer is to counter community transmission and raise the chance of herd immunity. Mass vaccination can diminish the abundance of the virus in a community. Dr. Jill Weatherhead, assistant professor at Baylor College of Medicine, explained that as long as the virus is not circulating and there's a high vaccine immunity, the risk is minimal. On the other hand, an ongoing high transmission increases the risk of someone getting sick. Although the risk remains, a surge in cases is unlikely to happen because most people are vaccinated and can easily fight off the infection. Keep a spare mask in your bag or pocket, maintain physical distancing, or use properly spaced tables in outdoor dining, and choose outdoor activities for socialization. Don't forget that there's no vaccine yet for kids.